Hello everybody, Mrs. Miller, and we're going to be talking about a TENS unit today. A TENS unit stands for Transcutaneous Electrical Nerve Stimulation. TENS units are used to help alleviate muscle spasms and chronic pain in patients with overexertion or somebody who has a chronic injury. When it flares up, we can go ahead and use a TENS unit to help relieve some of that discomfort. When a TENS unit is applied, small, tiny electrical impulses are transmitted through the skin into the muscle, and through this process, we are releasing our own body's ability to manage pain. We call those endorphins, and they will go ahead and help the patient to relax and help to relieve some of the discomfort that they are experiencing. What we're going to do today, I'm going to show you how a TENS unit works, how it is placed, and we will walk through those steps. So the parts of a TENS unit are the controller, which will go ahead and determine the mode of how the electrical impulses are going to be delivered. Electrodes that are placed on our patient's back. You notice it's sticky and there is a gel-like substance that helps the conductivity of the electricity impulses go into the muscle, as well as the cable that attaches the TENS unit to the electrodes. Patients control the amount of stimulation that they receive. Some patients say it feels like ants crawling across their skin. We can also dial this up with enough energy that we can actually make muscles twitch. That is way too much energy and is a bit uncomfortable for our patients. So we go ahead and set this up, and then the patient can go ahead and adjust this sensitivity for as light or as heavy of an impulse that they feel is comfortable for them. Our patient today is complaining of lower back pain from being very active at work today. So his complaint of pain is located right in this region. So what we're going to do is we're going to take our electrodes and we're going to put one on each side of the muscle here that is causing him discomfort. So we'll go ahead and place one electrode here. And we're going to go ahead and place the other one a little further down his side. And what's going to happen is the electrical impulses are going to be transmitted through the electrodes. As you notice, it's very sticky, and this is the conductivity portion of the electrode. So we'll go ahead and apply that. We want to make sure that the skin is clean and dry and that there's not a lot of oil or lotion on the skin, because that will go ahead and decrease the ability of these electrodes to stick to our patient's skin. So we'll go ahead and first off, we always turn the unit on, and we go ahead and put our cable into the bottom, and we'll go ahead and attach the electrodes. Doesn't matter if white or red go on which one. No, it does not matter. And what we're going to do is we'll go ahead and give the controller to our patient to go ahead and begin the process of increasing the energy setting in this region. Okay, this is the controller that the patient is going to use to change both the mode and the intensity of the impulses that is being delivered to the muscle. So as we see here, we can see the electrodes are in place and the patient is adjusting the stimulation to the muscle. And as the energy keeps increasing, we may see twitching of the muscle. Twitching of the muscle is uncomfortable for the patient. If you would think about repetitive motion with your muscle, with your arm gets very fatigued and it is very uncomfortable. And that is what happens when the intensity of the unit is continually increased. As you can see, we adjusted the electrodes because the stimulation that was occurring with the TENS unit was not necessarily hitting the right muscle group in the right spot. So this is something patients are going to do. They're just going to move the patches around, adjust the intensity with their controller so that they can go ahead and get the best possible relief from the muscle spasming and or just muscle pain. And that is a description of a TENS unit. If you have any questions, please email Mr. Dorsey and he will then forward the questions off to me. Thanks and have a great camp.